Hi, everyone. We see that the room is open and people are starting to come in. There should be audio. Team's phone, is there audio? I heard David, but it's now silent. I'm not sure what to say about that. There is audio. We're in a Zoom session. We have 132, I believe. Yes, everyone should be muted. Except for me and Karen Perry and the speakers, if Jen Nelson may be. So everyone will be muted. We still have some people coming in. We are recording, so we're going to get started in just a second. Just want to say welcome. I'm going to ask a couple of things I'll probably repeat, and that is if you have questions, could you please put them in the Q&A for me? And we will get to the questions at the end. There will be time for questions from the Q&A at the end, at which point Karen and I will go over the questions and try to answer as many as we can. Welcome to NJHealthConnect at your library, everyone. We'll get started in a few seconds. I don't have the time on my screen that I can see. So, Karen, do you have the time, or I don't want to wait too long?
I have 2:03, Michelle.
Okay. Okay, so let's get started. We have about 70 people online right now. As people come and join, if they come a little bit later and join us, that's fine. The webinar will be available on the New Jersey State Library's website. It is being recorded, as will the FAQ pages that we have. So I want to welcome everyone to NJHealthConnect at your library. And I know you've come here to learn about this exciting program. My name is Michelle Stricker, and I am the Deputy State Librarian for Lifelong Learning here at the New Jersey State Library. I'm going to be joined today by Karen Perry, who is the Manager of Information Services at the East Brunswick Public Library and a certified health librarian herself. We may also be joined by Jen Nelson, our state librarian. I know that this is a very busy day for webinars, so we'll see if she does log on and can let us know that she's here, because sometimes she has the best answer to some of the questions. So you are all muted. I would like to ask you please to use the Q&A for any questions that you have. And there will be, when we're finished, there will be plenty of time. We'll go on as long as you need to answer all of your questions as best that we can. So in the meantime, please use the Q&A for your questions. We will get to them at the end. And as I mentioned, the webinar, as well as an FAQ page, is going to be posted on the New Jersey State Library website for you to access. And what's going to happen is at the very end of the presentation, you're going to receive a link to that web page where you can go and find out all of the information. So right now, welcome, and let's tell you a little bit about Health Connect at Your Library that is being funded by the American Rescue Plan Act of 2021. Most of the funding is all being administered here by the New Jersey State Library. And as many of you know, we have a lot of programs that are going on right now that are ARPA funded. This particular program, though, is going to be implemented by Just for the Health of It at the East Brunswick Public Library. And it's going to be really overseen by Karen Perry, who's joining me today. And as I said, Karen was the manager of information services at East Brunswick Public Library and also a certified health librarian. But just a little bit more about Karen, I wanted you to know. She's been running Just for the Health of It probably since around 2009 or 2010 or so. And in 2018, she received the Library Journal Mover and Shaker Award for Just for the Health of It, which was really East Brunswick's answer to provide, trustworthy health information for consumers that were looking for a better understanding of like their medications or advice on how to talk to their doctors or just for tips on how to improve their general wellness to begin with. So Karen, I think, couldn't find anybody better to help us run this NJ Just Health Connect at Your Library program. So the reasoning behind NJ Health Connect. Now, as you know, the ongoing pandemic really has put a spotlight on the healthcare system, especially among the most vulnerable, and especially since COVID. I mean, maybe many of you have had, telehealth sessions with your doctors. If you're connected, you're on your phone, you're on your iPad, you're on your computer, and those have been mainly very successful. But there are a lot of people who just don't have the ability to connect in that way, and they also don't have the ability to get a lot of good health information. And Karen's going to tell you a little bit more about that as we go along. But there's definitely a need, and you could see, I'm sure you've read about it in various library magazines, or through what other libraries are doing. There's a role that public libraries can play in advancing health equity. That this is what we're going to be trying to do and bridge through NJ Health Connect at Your Library. It's a really new program in the state that we want to address, as I said, the inequities through a combination of technology that's going to offer links to telemedicine apps for doctor's appointments, links to information about COVID, and to high quality health literacy resources. And most importantly, there's that human connection that you're going to have because it features a team of certified consumer health librarians at East Brunswick Public Library who will facilitate and train the New Jersey librarians who are going to take part in this program, and it's going to train them to implement a telehealth program in their own communities. So in your own communities, you're going to get the training and the support you need from a live team of certified health librarians, which I think is a huge benefit and a huge selling point to the program that we've devised at NJ Health Connect. So I'm going to turn it now over to Karen Perry, who's really going to provide all the details about the program. And she's going to talk about the need for the statewide public health services, how the program is going to run, about the MOU that will be signed, and all the specifics about the program. She will answer most of your questions, hopefully. And then, like I said, at the end, we'll come back in and do Q&A. So Karen, I'm just going to pitch it over to you and take it away.
Thank you. And thank you, Michelle, and welcome everybody. I'm so happy that everyone has shown interest and is attending this program. I'm so happy to be here to launch NJ Health Connect at Your Library and to share what could be a once-in-a-lifetime opportunity to get free iPads for your library while making your communities a healthier place. The timing could not be more perfect. Just this past October 2021, the IMLS released a study that said the presence and usage of public libraries is positively associated with multiple dimensions of social well-being, and they specifically mentioned consumer health. We all know that libraries are trusted institutions in every community, where judgment is left at the front door. They're safe spaces of unbiased knowledge, where information is reliable, every person feels welcome, safe havens for the physically and mentally ill, those with substance abuse, and homelessness, regardless of language, literacy level, country of origin, or how much money people have. But the real gem of libraries are the librarians, who bring a unique blend of compassion to help and knowledge to educate and empower. It is this synergy between libraries and librarians that is the perfect recipe for creating healthy communities. Next. Next, Michelle. Access to good health is not always as fair as we'd like to imagine, especially among marginalized populations. That includes the poor or low income, the elderly, and especially immigrants. This is called health equity, because everyone deserves equal access to good health and the chance to live their best life possible. The ability to see a doctor, access health information that they can understand and act upon to advocate and make informed choices about their health. But sadly, there are multiple factors that contribute to health inequity: language barriers, lack of financial resources to purchase a computer, no health insurance, no doctor, low literacy, one's native language may not be English, or perhaps they can only read health information in their native language. Or they perhaps speak English, but their literacy level is very low and they can only read and understand at a very low level. And these people are oftentimes left out and cannot advocate for their health and make an informed health decision. Public health experts have documented these people as being at what they call high risk. High risk for poor quality of life, diagnosis of diseases like diabetes, cancer, or hypertension at a later stage, longer hospitalizations, more frequent hospital recidivism within 30 days, longer recovery, and sadly, higher risk of death. New Jersey is home to many of these vulnerable individuals, especially our immigrant communities. The Census Bureau recently ranked New Jersey as the #6 most ethnically and racially diverse state in the nation, and 2 of New Jersey's counties, Middlesex and Essex, now rank among the nation's most diverse counties. In fact, they say that all of the countries of the United Nations are represented in New Jersey. Next. Public health experts talk about what they call the social determinants of health. They define it very simply: where people live, where they work, and where they play. It is important to understand the social determinants of health because they form the underpinnings of the NJHealthConnect project. Understanding the social determinants of health will put this project in context, help you better understand the health needs of your community, especially those of you whose libraries are located in the most vulnerable communities. Social determinants of health includes things such as cultural beliefs, access to supermarkets where there are fresh fruits and vegetables, parks to exercise where there's fresh air, access to safe streets, having a house and a safe place to live, having a job, access to technology and computer ownership, having health insurance, being able to see a doctor, a dentist, get mental health support if you need it, and even transportation is considered a social determinant of health because you need a way to get there. NYU School of Medicine a couple of years ago studied the lifespan of people who live in the 500 largest cities and how long they will live. And guess what they found out? It wasn't genes and it wasn't gender. There was a growing body of evidence that said that the single best predictor of a person's longevity may well be a person's zip code. They found in their study that some neighborhoods can expect to live 20 or more fewer years than those in more affluent or prosperous neighborhoods just blocks or miles away. Next. Go back up, there we go. In line with the social determinants of health, many immigrants work unusual hours and fill many odd-hour jobs in key sectors of the economy. Many poor people and immigrants cannot afford to pay monthly premiums for health insurance and don't see a doctor often until it is too late. For them, telemedicine is the answer. They say that telemedicine humanizes medicine. It has now become a widely accepted and mainstream way of leveling the playing field in healthcare access, especially among at-risk individuals, by virtue of its convenience, portability, and affordability, which is about 50% less, sometimes even more. It is a growing industry. In fact, Deloitte Consulting recently estimated that it will be a $3.5 billion industry, or will bring in $3.5 billion in revenue by the end of 2022. So it is a growing industry. New Jersey HealthConnect addresses the social determinants of health by offering access to low-cost, 24/7 telemedicine for people to perform basic doctor-patient interactions, such as diagnosing physical and mental health issues, doctor conferences to review treatments, review prescriptions or renew prescriptions, review test results and plan next steps, and even interview for a job, because the World Health Organization actually identified having a job as a social determinant of health, because without that, people don't go to the doctor, they don't have health insurance, and it's a cycle. So next slide, please. So how will the program work? Well, in a nutshell, the program uses public libraries in New Jersey to promote health equity to individuals who reside in at-risk communities. Many of these patients in these communities, or patrons, lack access to technology, they don't have a medical provider, and lack access to health information due to financial or lifestyle constraints or language barriers. The program will distribute iPads to selected libraries. Each library will receive between 1 and 5 iPads. The iPads will be distributed preloaded by the East Brunswick Information Technology Department. They will become preloaded with apps and links to telemedicine sites of the major hospital systems that are geographically located throughout New Jersey, linked to MedlinePlus.gov's links for multilingual health information, so that if someone wants to read about a certain disease in, say, Hindi or Gujarati, they can go on and read about it in their native language. And these, actually, MedlinePlus.gov, those are human translations, they're not machine translations of health information. Also places for mental health support, which has been identified as an overarching health priority by our hospitals. COVID resources in English and Spanish, which is constantly changing, and a link to the Just for the Health of It health portal of the East Brunswick Public Library. The beauty of participating in this program is the iPad will remain yours permanently. It will remain the permanent property of your library when the project ends in September 2022. Next, please. So, go back, there we go. So this is what the iPad screen will look like. And I want to give a shout out to Kathy Churn, our wonderful consumer health librarian, who put this prototype together for me. You see we have, it's very simple. We have 12 apps, 3 rows. The first row is links to the telemedicine site. Again, geographically organized Virtua Health, which is mostly South Jersey, RWJ Barnabas, Hackensack Meridian, which is Connect Now, and Atlantic Health System. We have a Zoom app and a Google Meet app, and in order to do things like doctor conferences or job interviews. We have links to NAMI and the Mental Health Association of New Jersey, because mental health is an overarching health priority right now. And we have the multilingual health information and link to Just for the Health of It, as well as the New Jersey COVID information, which is available in English and Spanish. So again, I want to stress that this is a prepackaged program. Your library does nothing except literally open the box and turn it on. The iPads will come pre-configured by the East Brunswick Library's Information Technology Department, who has loaded on something called Meraki Management Software. The Meraki Management Software is controlled remotely by our IT department. So anything that has to be changed or updated, added, deleted, has to be done by our IT department. And the iPads will also be controlled with SIPA compliance by our IT department. So it's simply a matter of just taking it out of the box and turning it on. Next screen, please. So like I said, this is a team effort. There will be a NJHealthConnect librarian who will be your point of contact for this project for all libraries. The NJHealthConnect librarian will be there to support you, provide training, answer questions, troubleshoot problems. It act as the interface with our IT department. And in addition, you will have the ongoing support of EBPL's, East Brunswick Public Library's Information Technology Department, who will manage remotely all of the iPads. One thing I did not mention is our library has a marketing coordinator, Chris Barnes. Chris is creating flyer templates and social media messaging. So your library has to do nothing other than just pop your library name in. If you don't have someone to do that, Chris will happily do that for you. And there you have it. You're all ready to go with your marketing or for your website or your social media. And of course, we have the support of Michelle at the New Jersey State Library. And the magic is really going to happen with your library and your patrons. So it is, it's really a big team effort. Next slide, please.
Karen, you want me to take this one and chime in if I missed something?
Yep.
So probably one of the questions are going to be, how are we going to select the public libraries for the program? And basically, it's going to be on a first come, first served basis. No library will receive more than 5 devices. Now, really, we don't anticipate that we're going to be turning, anyone down. We think that we have enough funding that we can serve all the public libraries that are interested in participating in the program. But because if we do get some overwhelming response, because the goal is that we do want to reach the underserved communities, the New Jersey State Library, along with East Brunswick, are going to be reviewing, we would review then the whole list of libraries and probably kind of compare it to that MRI, to see which would be the most underserved communities. But that would be only in an instance in which we said, we just simply can't give out all the iPads requested, although we do have around 300 on the list. So we'll have to see, how the response to that goes. So Karen, did I miss out anything on that?
You got everything, Michelle.
Okay. So,
Right.
You want to take that over from there?
Yeah,
I'll
pick up from here. So I guess the question that everyone out there has is, what is expected of my library? Well, my answer to that is minimal effort, just passion to help and make your communities a healthier place. What we do ask is that you provide a dedicated point of contact for the NJHealthConnect librarian to interface with, because they're going to need someone to call, someone to send things to. So that's an important thing. We ask that you adhere strictly to our marketing templates, which will have the logos that are required to market this project and include the social media messaging that Chris Barnes, the library's marketing coordinator, will provide. Again, these are all ready-made. All you need to do is pop your library name in. We ask that you loan out the iPads according to your library's lending policy. So we're not going to set one. It's up to whatever your respective library does. We ask that you dedicate a private area for patrons to use to conduct appointments if they want to do their doctor visits or their job interviews in the library building. I know that all libraries do not have quiet study areas, but just a private area. And that the most important thing is that you track the number of times that each device is loaned out. We can't ask what a device was loaned out for the specific purpose. Sometimes patrons will tell you, oh, I'm meeting with my doctor, or I have to renew a prescription or something. And that's great. That's a story, and librarians love stories. And if you can capture those that are voluntarily shared by patients, that's even better. But what the NJHealthConnect librarian at the end of each month will reach out to the dedicated point of contact at each library and ask for just the number of times that each device was loaned out. And we also ask that the iPads are used only to support the program through September 2022. Again, the iPad screens will be locked down, so you cannot alter them, or you should not be able to alter them. And of course, we want to make sure that you sanitize each device when it is returned before loaning it out to somebody else. And the beauty of the whole program is at the end of 2022, the iPads are yours, no matter if you have one, or as Michelle said, if you have 5. Now, we certainly encourage libraries to maintain some semblance of the program on their own, using their own IT staff or their own staff. And that would, again, that would be up to your library. If you do not want to do that, EBPL's IT department can remotely remove the Meraki management software so that your iPad is now freed up for general use. All right, so we ask that people sign up by December 10th. I'll let Michelle talk a little bit more about this, but we really don't expect this to get going before January of 2022, only because we have to get everyone who's signing up and get everything going. But we do want to have a deadline for people to sign up. By December 10th, you email me, kparry@ebpl.org. It will take a few weeks before your library will receive confirmation, either from me or the NJHealthConnect librarian. There is a MOU, a memorandum of understanding, that your director must sign. Again, that will go through the terms that I just read off to you. And once you're ready to go, the NJHealthConnect librarian will reach out to you, send you your pre-configured iPads. She will conduct training if you need it. Chris Barnes, our library's marketing coordinator, will help you with the social media messaging. He'll send you the pre-made flyers and the messaging. The EBPL staff is managing the program. We are here to answer questions. We are happy to visit you in person to help you to learn about the device, how to use the apps. The consumer health librarians on my team are experts in this. We can do it in person. We can do it by Zoom. We can do it by phone. Or you may just figure, I'm taking it out of the box and you're on your way. Again, we just ask that you use the flyers and the social media messaging. And we'll be happy to work with anyone that needs help with marketing. My feeling is these programs are always great, but if you don't market them, if you don't get out there, market them, let your customers know, especially those of you who serve patrons in at-risk communities, that you need to really let them know that this is there for them, that these devices are there. They can be loaned out according to your library policy, and they're there to help to improve their health. So I just want to end before we do the Q&A by saying that the IMLS in the recent October 2021 2021 study stated that museums and libraries are indispensable connective tissue that keeps healthy communities together. So I really hope that New Jersey libraries will all join together and we will be national leaders in this endeavor and show that libraries throughout the country can really make this happen. So I'm going to turn it over to you, Michelle.
Thanks, Karen. I think Karen mentioned earlier that through the American Rescue Plan Act funding, it's been absolutely extraordinary, the possibilities that we've had over the last year. And, throughout my career here at the State Library, I mean, this funding has never happened. And so I really encourage you to take advantage of this program. As you can see, I'm going to just give a shout out to Karen and to the director of her library, John Hanson, and to the entire team there, because they are really doing the heavy lifting through the whole program. I had originally called her, and Karen's the person that I always think of when I want to talk about mental health programming that we need to do. And I had originally called her to say, "Hey, Karen, what are we doing with telehealth? Is anyone doing telehealth in the state of New Jersey?" And Karen just is like, "We can run that. We've got the certified health librarians." So they just really stepped up in a huge way. The memorandum of understanding that you'll sign is really, as we stated, very minimal. It's just stating basically that you're going to receive X amount of iPads. They're going to be preloaded with the apps and with the resources, and that you are going to use them strictly for the telehealth NJHealthConnect at your library through the mid-September, and that you'll keep statistics on them. So, it's really very minimal what you have to do to sign up for the grant. And I really hope a lot of you are going to take advantage of this, because it just might not happen again, or it might not happen again for a very, very long time where we're able to get the funding for that. So with that, I'm giving you our contacts here. There's my contact, there's Karen's contact. And this is a website. This is the address on the website where you're going to find about the NJHealthConnect grant, where we're going to post the webinar from today, where we're also going to post the FAQs. And so from here, Karen, stay on, and I'm going to open the Q&A, and I'm going to see what we have here, and I'm going to read them out loud and see if both of us can answer them. So I have a question from Mary Fran, and that is, will patrons make appointments, or are healthcare providers available as needed? Might patients incur costs? So Karen, I think, go ahead.
I'll speak to that. People often have a misconception that telemedicine is free. It is not free, but it is significantly lower cost than walking into a doctor's office. That's why the industry is expected to grow so extraordinarily over the next few years, especially for people that do not have health insurance, that cannot afford to pay those hefty monthly premiums. Telemedicine is a good solution. Once they connect with a doctor through one of these sites, they actually may be able to get free health care. I know that Robert Wood has doctors that will work for free for people that are very financially disadvantaged. But keep in mind, it is significantly less. You're talking an average of $40 to $50 per visit, as opposed to an average walk-in visit to a general practitioner is $176. So significantly more affordable for people. And again, these people are not paying monthly premiums for health insurance. But again, the iPads can also be used for any kind of conferences, or also for things like job interviews. Like I said, that's an important social determinant of health. So there's multiple ways. And also, I also want to let people know that the access to health information, health literacy, is a big part of what this program offers. It's not just telemedicine, it's access to multilingual health information, mental health information and information about COVID resources in English and Spanish. So keep in mind that if someone comes in and their native language is not English and or someone comes and says their mother only speaks, Spanish, you can provide them with a device where they can link to multilingual health information.
Okay, I have a feeling, Karen, you're going to need to answer all of these, but I'll at least read them out to you. So
all right.
For the iPads, Andrew asks, will there be controls to prevent the downloading of other apps by patrons? How will we be able to prevent them from using the iPads for anything other than, it's not just for the health of it, that's specific to East Brunswick. It is for the NJHealthConnect at your library, actually.
Well, the iPads are going to be locked down by our IT department. We had a whole discussion about this, whether we would have the libraries manage the software or whether we would do it. We decided in the interest of control, not that we're control freaks at East Brunswick, but there has to be an amount of control on this because people are going out into the internet. We decided it would be in the best interest of everyone if our IT department actually managed the iPads. The beauty of this Meraki management software is that it can all be done remotely. So the answer to your question is, can we prevent them from using it for anything other than NJHealthConnect? They should not be able to use it for anything other than NJHealthConnect. We do ask that the librarians, when the devices are returned, make sure everything is intact. If you see something, immediately you have to let the NJHealthConnect librarian or me know, because I will immediately get our IT staff looking into it. But I don't anticipate that. Okay.
Okay. So next is, will a library system be able to apply for each branch? For example, if we are a 6-branch system, would we be able to apply for each branch? So I'm going to try to answer that one. I'm not sure. I didn't see that Jen Nelson, our state librarian, is on the webinar today. But Jen, if you are, please feel free to pipe up. I have a feeling that it's just going to be per system because, some of our systems are 20 branches, and then 20 times 3 or 5 might be just like a sort of, overwhelming amount of iPads that you would get for your library. So I'm going to double check that with the state librarian. I think it's going to be 5 per system. However, as we go back in and if we discover that, hey, we have a lot of iPads left over and we have a big county system that's, asked for them, maybe we can up the amount. And that's only something that we're going to know once we really receive, or Karen gets the email that you definitely want to participate in the program, you're willing to commit to signing the MOU. So I halfway answered that one, probably not to your satisfaction, but I am going to double check on that, and I will add that to the FAQs when they go up on the website, Heather. Okay, so the next one from Joanne is, can we let the patron take the iPad home to use for their appointment? Karen and I did discuss this. You want to take it or?
Yeah, absolutely. We encourage them to take the iPads home. Again, according to the lending policy of the library, their own library, where they're obtaining the device. Absolutely, they could take these iPads, check them out, take them to a restaurant, like I don't know, a Starbucks, or in their home or a relative's home, any place where there's Wi-Fi. Keep in mind that these devices do not have cellular access. You must use Wi-Fi, and you must either use the device within your library in a quiet, private area, or go to a place, whether it's a home or a business that has Wi-Fi. So absolutely, they can be taken out, and they should be taken out. And I would think more people would prefer to take them out.
That is up to the library's policy. There were, in the beginning when we were having some questions, or people who said, I just wouldn't feel comfortable about letting patrons take them home. And there's others that, as you said, want to take them out. So we leave that up to you. Whatever you want to do, you could do. All right, from the Minden Borough Library, what happens if a patron needs to contact a hospital not included in the listed icons, such as Memorial Sloan Kettering?
They absolutely can. They can absolutely do a doctor conference with a doctor from Sloan Kettering using Google Meet or using Zoom. I happen to have a father who's in his 90s who does conference regularly with Zoom with his oncologist at NY New York Presbyterian. We do not have apps that go directly to Sloan Kettering. I'm sure has their own telehealth, but they absolutely can be used for doctor conferences with Google Meet or with Zoom.
Okay, and Fran asked, where is the link to apply? Well, you apply directly to Karen Perry. You're going to email her and say, yes, I would like to take part in this program. This is my library, and this is how many iPads I think that we will need. And you have until December 10th to do this. I think that was listed somewhere in the presentation. It's also listed on the website at the web address there. You have till December 10th, at which point we're going to collect all the libraries who said that they have an interest, and we are going to see if we can accommodate all of them with the number of iPads that we can purchase through the grant, and we will let you know how many you will get after the first of the year. Okay, so Jill asks, can you please clarify that patrons will be unable to use other apps or tools on these iPads, and it is locked down so they can only use the specified tools?
Yes, the answer to that is that these devices will come pre-configured. They will be locked down specifically for the purpose of NJ Health Connect. Once the program ends in September 2022, you are free, if you wish, to either, like I said, sustain the program on your own, or our IT department can remotely unlock the iPad so that you can put other apps or other links on it. But this is an iPad that supports a specific program that is to help people who are marginalized, who need access to health information. So during the duration of the program, that is specifically the purpose.
And, that is specified in the ARPA requirements that it be used, that there are certain criteria that are listed in the ARPA, what they will fund. And this is one of them. And so in order to utilize that funding, we have to use it for specific purposes. If you're familiar with a lot of the programs the state library has been doing, that there are a lot of different ARPA programs like the NJSL Plus Literacy Project. But this is another one that we're using and able specifically to use the ARPA funding for the telehealth and the telemedicine. Let's see, Jill, we answered that. So anonymous, are the devices checked out for in-house use, or are customers allowed to take them home? I think we answered that one, that we hope that you'll let them take them home, or if you want them only to use them in your library, that you provide a private space for them. We don't need you to set up, as you may have seen a lot of other libraries are doing. They have a separate room where they have like blood pressure cuff and the pulse ox and different temperatures and things like that. There's none of that, none of that. But if you have a private area in your library and you're not going to let them check out the devices, it would be nice that they can go somewhere quietly where they can speak to their doctor about private matters without anyone seeing what they're doing or overhearing what they're doing. Linda asked, will there be training for librarians to become certified health librarians? So
that one I'll ask. The certified health librarians, I assume you mean the Consumer Health Information Specialization, what we call the CHIS or CRIS specialization. That is something offered through the Medical Library Association. That is not part of this program. You can, or your patrons can submit a health request through the Just for the Health of It portal that EBPL's certified health librarians will answer and provide health information to your customer. However, the program does not include the certification. However, on a personal level, I do encourage librarians to become, or get one person on your staff to become a certified health librarian. We can help you do that by pointing you in the right direction. I have contacts at Medical Library Association that I can absolutely put you in contact with. Just for those of you who are not familiar with the CRIS certification program, it is a certification program that public and special librarians can obtain. It's a certification. It's a level 1 and a higher level 2, where you are required to take a certain number of hours in classes in all areas of consumer health research, whether it's child health, teen health, drug information, clinical trials, refugee health, mental health, helping people. I think I said refugee health, but our librarians are always taking classes every month. On the EBPL staff, most of the librarians are already level 2 certified, which means that they have to continue to take classes. But I do encourage at least one librarian at each location to become CRIS certified if they can. It takes a little bit of time in the beginning, but it's a really great program, and it'll really help you feel much more immersed in public health for public librarians. So reach out to me specifically if you want to pursue that, and I'll help you.
Okay, so let's see. If the healthcare provider, Jennifer asks, uses a different program than those that come preloaded on the iPad, can those be added?
I would say probably not, only because there are a lot of telemedicine sites out there. But again, reach out to me if I notice a trend, and a lot of people are saying, a lot of doctors are using this telemed, provider. We'll certainly consider it. And the beauty of the Meraki management software is that our IT department can add that app remotely that'll automatically go out to all of the devices. But again, let's take that on a case-by-case basis, because I think right now with what we have, we hit the major hospital systems in the major geographic areas in New Jersey. So let's play that by ear, but we can address that separately.
Okay, let's see. Sandra asks, I don't understand how job interviews fits into the NJHealthConnect program.
Okay, well, jobs and employment is considered a social determinant of health by the World Health Organization. The reason being is because when people don't have a job, they don't have health insurance. When they don't have health insurance, they don't go to the doctor. When they don't go to the doctor, they end up either living with a chronic disease, or they can end up worse than that. Where they end up in the hospital because they had some kind of a chronic illness that they didn't know that they had, or a health condition. So it all circles back to employment equals health insurance equals the ability to see a doctor and diagnose disease, whether it's to diagnose a condition or live with a chronic condition in a manageable way for optimum health outcomes. I know it's kind of a public health way of stating it, but it is interesting when they talk about the social determinants of health. One of the things that always surprised me, that transportation is a social determinant of health. And when I learned that from the hospitals, and it makes sense, that's another one. When you can't get to a doctor, or you can't get to a hospital for your radiation treatments, that all affects one's health. And the hospitals are very aware of that. And actually, you see a lot of companies now, like Uber, they're partnering with hospitals to provide transportation for at-risk individuals so that they can make it to their doctor appointments. So, but that's a good question. Yeah, but yes, employment is part of it. And I knew I would have to explain that, but it's a very important part of it. People that have jobs are healthier.
I see that our state librarian, Jen Nelson, is on the call. Jen, you're trying behind the scenes to figure out how to unmute you so that you can also talk. So Betsy's working on that, and apologies, we're doing get you unmuted as soon as we can. Okay, so is there a list of telehealth providers loaded with the iPads and with suggested consulting fees listed?
We don't have their fees, but we do have the major telehealth providers are, again, I consulted with our local hospital because we don't want to, I didn't want the screen of the iPad to be so crazy and cluttered. So I really wanted 3 or 4 of the major systems. So I consulted with people at Robert Wood Johnson in New Brunswick who said Virtua Health, RWJ Barnabas, Hackensack Meridian, and Atlantic Health. Those are the main ones. The fees actually for telemedicine may change based on what it is that you're asking or what it is that they have to do. So again, I do want people to understand, it's not a free, so telemedicine is not free. It is just significantly less. And it's also, again, it's accessible for people, especially they have done studies with immigrants, many of whom work odd hours, nighttime hours, and they cannot see a doctor because of their lifestyle. So telemedicine offers that 24/7 access in a much more affordable way.
Okay, let's see. Thank you. I lost connection briefly, but I caught the end of the answer. Heather, let us know if you need us to repeat anything. Jen Nelson, I see that you're on, but you are still muted. So hopefully there you are.
Yeah.
Okay, we hear you. Okay. Did you want to pipe in with anything, or do you want us to continue on down the
No, you
list?
guys have it covered.
Okay, so let's see. Okay, will the iPad need to be wiped of any personal information the previous user might have entered? Do iPads keep history of previous searches? I know Karen knows that one.
Actually, technically, again, they should not be able to alter any interface, but in terms of the information that is there, we would ask that every library, when the devices come back, make sure that everything is cleaned out. I will actually talk to our IT manager more about that because I don't want to give the wrong information, but that is a good question. There should be no personal information whatsoever on these iPads when they're returned.
Hey,
That's good. I'm going to follow up on that with Alpesh.
okay. Jill asked, what about iPad loss or damage? Is this per our library's policy, or is this something in the MOU that will determine costs? And I think Karen and I, we talked about that, and I think we talked about that with Jen, and I think that is going to be per your library. Is that what we talked about? Kind of decided that you really run the program. We're sure that there's other technologies you may be loaning out. So whatever your policy is going to be as far as, what the replacement costs are. I realize these are iPads and they're highly desirable items. So, again, that's going to be what your lending policy is going to be, what your replacement policy is going to be. It's really going to be up to you, loss or damage, as per whatever you want to decide is best for you. Anything else, Karen, on that one?
No, I think you covered it.
Okay. And, one interesting point that I wanted to add, why we're using iPads instead of Chromebooks, because that was, a lot of libraries loan out Chromebooks and hotspots. But the Chromebooks, you cannot add a lot of the telehealth apps to that. So originally we talked about doing Chromebooks and iPads, but it was decided just to go straight with the iPads, primarily because they had the apps that were available and the apps that people really needed to use. Okay, Summit Library asks, will individual libraries be able to add health-related apps such as local medical groups apps that are not already installed?
Okay, let me just circle back to that. Technically, the project is launching with those 4 telemedicine providers that we have. However, this is a fluid project. If we find that a lot of libraries up in the Summit area are saying, you know what, I really need the telemedicine for Summit Group, absolutely. We want to make this project work. That's, again, the beauty of this remote management software is Alpesh can remotely add that app. Everyone will get the app because it'll go to all of the devices like instantly, but I don't want to let people feel that, I'm not going to sign up because, my hospital group is not represented. Again, the ones that we have, those are the real big systems. They're the giants of healthcare in New Jersey, but we may find that, we're getting requests for smaller health groups and we'll need to add those apps. So please keep an open mind and let me know. And that's why we need a point of contact designated at each library so that they can relay this information to the NJHealthConnect librarian.
Great. And Joanne asks, how does the patron find the doctor they need? Do they check out the iPad to make the appointment and then check it out again for the actual appointment?
Oh, they would find it. Well, the librarians can help them find a doctor. They may have a doctor they know. For most telemedicine sites, you don't need to have a doctor that at all. You specifically just go on the site and you sign yourself up, and sometimes they give you a time, sometimes you're immediately connected, and you speak to the doctor that whoever it is that you may need someone like an ENT or a general practitioner or an orthopedist. But the way I've seen telemedicine work is generally you just go on and you like instantly get a doctor. So it's pretty simple.
Okay, what is the cost if the iPads are lost or damaged? Now, I just think that would be whatever the cost of the equipment is, whatever the iPad, whatever version of the iPad or model of the iPad. I think the cost would only be replacement cost of what it would cost for you to replace the iPad. Is that correct, Karen? I don't think there's any cost for anything preloaded on there. Okay, so it's just for whatever the iPad is, and you will know what model you are getting. Can you give us more information about training? When will the training take place?
Okay, so here's how this will work. Once your library is signed up and approved, the NJHealthConnect librarian will be in touch with you. We'll send you the number of devices that were approved by Michelle at the state library. You will be sent the devices, excuse me, in a box. You will simply take the device out of the box, excuse me, it will be preloaded, and you will start using it. Now, some libraries may be perfectly comfortable using all of these apps, playing around with them, taking a look at the mental health apps, the COVID apps. For those of you who are not familiar with MedlinePlus.gov's multilingual health information, they're all really easy to use, simple to use. But again, we're doing health for a while in East Brunswick. So for us, it's kind of like home for us. But that's why I felt, and I told Michelle with this project, that we did need a designated librarian, because there will be libraries that will understandably need more hand-holding. And the NJHealthConnect librarian will either help you, they'll train you not just in how to use the device physically, how to use the device, but also the content, what is in all of these apps, so that you can more effectively speak about it to your communities and market this project.
And again, what happens if the patron damages an iPad? That's up to the individual library, whether you're going to charge the patron for that or not. Sheila asks, are the devices insured? If a patron damages or loses the device, is the library responsible for paying the replacement cost? You will not be responsible for paying, say, repaying East Brunswick for the iPad if the patron damages it. I don't believe they're going to be insured through East Brunswick. Karen, do you know any more about that? We didn't talk about insurance at all.
No, we haven't actually talked about that. I mean, right now, I'm kind of less focused on that. I don't want to tell people that we're not going to try and recover the cost, because you as librarians, you want to make sure these devices come back to help other people. So right now, you know, we also do the BARD program here at East Brunswick, and we've had BARD devices come back damaged. Sometimes people drop them, and BARD does not charge when that happens. They graciously replace devices. So you know what? I don't want to be a real hard nose about this right now. Let's just take it on a case by case basis. Some of these people, if we're really hitting the right people with this project, we're not going to be able to go after these people to recover costs. So let's try and keep an open mind and run this program with an eye towards compassion and less towards authoritativeness and trying to, you know, think about the worst that can happen.
Rosemary asked, would you recommend an optimal loan period for the device of, say, for example, 1 or 2 weeks?
That will be up to the lending library. We're staying out of that, plain and simple.
Okay, does it come with earphones? So if they use it in the library, for those who don't have Wi-Fi at home, so no one can hear what the doctor is saying. I don't think we talked about earphones,
No,
Karen.
that might be something good. We'll add that.
Yeah, we're going to add that
That might be something that I'm going to add. That might be something for the NJHealthConnect Librarian if you need them. Maybe we'll purchase some, not send them out with all of them. If you need them, we can provide them.
Okay. And how can we
sell them? Can we sell them in East Brunswick?
Yeah, I've seen that before too. How can we guarantee that the previous user's health information is not seen by the next person or the next patron? I think
again, when the devices are returned, we ask that every library take a look. They make sure everything is wiped out and ready to go. The device is cleared out, memory disinfected, and ready to go to the next person. That is why we need, or all of participating libraries need, a designated point of contact, because somebody has to be responsible.
In Southern New Jersey, a lot of patrons use doctors in Pennsylvania and Delaware. Will patrons be able to connect with physicians out of state?
I would probably say no to that, only because there may be some patrons that are using a doctor in Delaware, but I can't imagine that a lot of them are. But again, let's play that by ear as well. Again, if we find that there's a pattern, certain telehealth providers are preferred, we'll absolutely consider.
When you list the telemed, it doesn't matter where patron is located because it's virtual. What if the patron needs to physically see someone? I would imagine then they have to go in and see someone.
Yeah, I was reading about this. It's interesting because when doctors conduct telemedicine, that is in their training. Not everything can be done by telemedicine. There's certain kinds of things that lend themselves better to telemedicine. For example, talking about symptoms of things, renewing prescriptions, mental health questions, just some general maintenance of chronic diseases. But that's up to the doctor when they speak to someone. They may say, if someone says, look, I'm having, balance problems, what could it be? I mean, they're going to say, you know what, let's schedule you for some tests. And if the person says, I can't afford it, they know where the hospitals have ways to help people that do not have health insurance. So then it becomes, we're not the little people in the Telemed app. I mean, we're pointing people to the app, but the hospitals run these apps. It's up to them once the patient is in the system. It's part of a big ecosystem of health. And once the patient is in it, they're now, it's responsibility of the hospital, not us.
Sheila, we're going to be posting the MOU in advance on the site, so you could decide if you want to participate, but we did review everything that's going to be in it, which is really not too much. It's just going to state you're going to get X amount of devices. You're going to use them for the purpose that they are intended to be used for NJ Health Connect at your library. And you're going to keep the statistics on them through the September of 2022, and then devices are yours. So that's basically it, but we will be posting it online. Ellen asked, our internet connection was interrupted, so maybe you already answered. Reporting requirements, what are they? Frequency of reporting, to who, where, thanks.
Okay, so two things. The NJ Health Connect Library will reach out every month to get the number of times that each device circulated. That's it. We're looking at volume of circulation. However, if you can get what I call stories, I know for grants that I've run in the past, the hospitals, they love stories because it really paints a complete picture of a project and the value added. So if patrons come in, and you may see people that don't have their own devices and start using this program, and they say, you know what? I go on every month and I talk to the doctor about my diabetes medication. I use Google Meet and we talk for 5 minutes we want to know that kind of information. So if you can't ask because it's health information, but if they volunteer, and people do volunteer, a lot of people actually like talking about their health issues. So especially with librarians, we have lots of experience in that. So, but really, you're going to concern yourself with just, you need to track the times that each device goes out, and any anecdotal things is, that's even better.
After September 2022, are the apps still operational, and what support will we need after the grant is up?
Okay, so when the grant is over, the apps will still be on because we don't, own the apps. You will have to provide your own technical support. If you still want to have SIPA on each of the devices, that will be up to you. But other than that, after 2022, you support it yourself with your own staff, with your own librarian staff, with your own IT staff. If you do not have it, absolutely reach out to us. We can talk to you about ways that maybe you can create a little mini health program. The librarians in East Brunswick, especially the NJ Health Connect librarian, we want to sustain this. Anytime you have grants, that they look at sustainment, ways to keep this going, not something that is just going to die. We'd like to keep it going. We encourage libraries to make every effort to support it on their own, even if it's a real simple version, just taking your own local hospital app or a doctor that's very popular, and then keeping a Zoom link and a Google Meet link, and Medline Plus Gov multilingual health information costs you nothing. Okay, it's free information. The COVID link in English and Spanish costs you nothing. The mental health information costs you nothing. And that's such critical information for your community. For those of you who just cannot or do not want to support it, our IT staff can disable all of the devices so that then you can just add and delete apps as you wish.
And John Arthur, the executive director of the East Brunswick Public Library, said, let me know if you want earphones in the budget. And John, I think that answer would be yes, for privacy in the library. So thanks. And we could talk more about that later if you want. And then the final question, and they will refer them to doctors in their area. In Gloucester County, Inspira is big.
Okay. Well, we'll look into that.
Yeah.
We want to add that.
Okay. So listen, this brings us to the end of our program here on NJ Health Connect. We hope that we answered the majority of your questions, and remember that this webinar and FAQ, just give us about a week and we'll get it up on the website for you to refer to. We will have the MOU up there too for you to see. And you have until December 10th to email Karen Perry and let her know if your library would like to participate in this program. We hope you will. We think it will be phenomenal. We have a budget for roughly 300 iPads. That's a good amount to spread around throughout the state. And Karen, are there any last words that you would like to say?
No, I hope I'll be talking to all of you.
Yes.
Very exciting.
Thanks for joining us today. I know we went a little over an hour, but thank you for your time and thank you for your excellent questions. If there's something that we didn't answer, please feel free to email either one of us. Although I'm going to tell you, as you can see, Karen is the expert in the area, so you're more likely to get a better answer from her. So thanks, everybody. And with that, I'm going to end it and say goodbye and hope you have a good rest of the week. Thanks for joining us today.
Thanks.
Bye now. Bye, Karen. Thank you.
Bye.
Bye, John. Thank you.